Dr. Bebat here. We're going to do the medical word of the day. The situation that I've thought about today is that of a subarachnoid hemorrhage. First, before we get into that, you need a little bit of a basic anatomy lesson. Your brain sits in your skull, obviously. The first layer on the outside of the brain is called the pia mater. The pia mater is then followed by small space or potential space to the next layer that surrounds the brain, which is the arachnoid mater. And then the final one that's right underneath the skull is the dura mater. When you have a subarachnoid hemorrhage, it bleeds between the pia mater and the arachnoid mater. It's usually caused by a ruptured aneurysm. It can be caused by other things, trauma, etc. And it is considered one type of stroke. The symptoms of a subarachnoid hemorrhage are what's called a thunderclap headache. It's a severe headache that just boom, all of a sudden it's there. It's the worst headache you've ever had in your life, and that is one of the questions in the ER that we ask when people come in for a headache is this the worst headache you have ever experienced? Because that's a warning sign of a ruptured aneurysm. A lot of people don't make it. It's almost immediate death in some people. If you go to the hospital, you still have a high chance or a high mortality from this kind of thing. There are essentially 4 different types of bleeds into your brain. The one we just discussed, the subarachnoid hemorrhage, but you also have an intercerebral bleed, which bleeds inside what's called the parenchyma of the brain, a subdural hematoma, or an epidural hematoma. And we'll talk more of those at a later time. Treatment for subarachnoid hemorrhage is neurosurgery. Sometimes they can go up through a blood vessel and clot off the aneurysm, endovascular coiling, but a lot of times it has to be your open surgery and they clip the artery or clip the aneurysm to stop the bleeding. So there you have our medical word of the day. It's a complicated and dangerous situation, subarachnoid hemorrhage.